So in this segment, I'm going to talk about the Master Beneficiary Summary File and kind of focusing on Part D related variables in that file. As Nate mentioned a little while ago, the MBSF is a very important file to researchers for identifying their denominator, their cohorts, based on characteristics like their enrollment characteristics. So yeah, we'll just briefly go over the MBSF as it relates to Part D. So first, here's a list of acronyms that used in this segment, so you can refer to this list if needed. Certainly, there are a lot of acronyms throughout these segments. So if you're not familiar with this file, we would recommend watching this supplemental video on the MBSF. That one will cover more about the content of the file if you're not familiar with it. Because again, today I'm just going to focus on Part D related fields. There's a link at the top of this slide that will take you to the CCW page where you can access the file layout and data dictionary for the MBSF. But in a nutshell, the MBSF is the main source of demographic and enrollment information for Medicare beneficiaries. It contains 100% of beneficiaries enrolled that year. So there's one file created for each year. And each member has their own unique identifier. That field is called Beni ID. You use that file or that field to link across other CCW research files. There's exactly one record per Beni. Sometimes I will just call beneficiary Bennies for short. One record per Beni, and that record will contain an array of variables that summarize their demographic characteristics and enrollment status. So before I dive into describing the MBSF Part D variables, I want to mention that the MBSF is built using data from the Common Medicare Environment, or CME. And some of the data fed into the CME is supplied by the Social Security Administration. So it's very reliable data, like demographic information that comes from the Social Security Administration is reliable. So you will also sometimes see demographic fields in the Part D event data. I know I've seen gender and date of birth in the drug events. We would recommend linking to the MBSF, however, to pull demographic data, because sometimes there can be a discrepancy between the MBSF and the PDE. So yeah, we would consider the MBSF to be more reliable. So enrollment information. So to determine if a Medicare member had Part D enrollment in a given month, you would look at a variable called the Part D plan coverage month variable. That would actually that's a summary variable that will tell you the total number of months in the year that the member had Part D coverage. But to identify if they had coverage in a particular month, you would look at the array of variables, Part D contract ID, 1 through 12. And okay, so there are actually two key variables to identify whether the person had Part D, and it's the contract ID combined with the PBP ID. So those two variables kind of identify the specific plan that the member was enrolled in that month. So there's one of those for each month, so therefore 24 total variables. But yes, if you are just wanting to say, oh, okay, I just want all Part D members, the logic I would use would be to say if the value of the Part D contract ID in January is equal to 0N or is missing, that means the member did not have Part D coverage. Otherwise, they did. So it's good to know, though, that the Part D contract ID and PBP IDs were encrypted prior to 2013. So beginning in 2013, they are no longer encrypted. And so that means that you can use those ID numbers to link to the plan characteristics file, which we're going to talk about later on. So the plan characteristics file just has a lot of more deep information about each particular plan. And prior to 2013, you would not be able to identify the actual name of the plan because the IDs are encrypted. But beginning in 2013, you can actually identify the actual name of the plan. Like you can Google a contract ID from 2013 data, and it'd probably come up with the plan sponsor and sort of the plan name, the contract name rather. So again, both of these ID variables occur 12 times, one for each month of the year, and you need to know both to identify the exact plan. The contract ID contains some intrinsic information built into it. The first character of that variable will kind of indicate to you what type of Part D plan Part D contract that it was. So, for example, an E indicates that it was an employee-sponsored plan. H indicates a local MAPD, PACE, cost, plan, or demonstration. R is a regional MAPD plan. S's are PDP plans, and X's are limit plans, which are kind of like a temporary plan to get somebody temporary coverage until they can get permanently enrolled in a permanent Part D plan. The values at the bottom, N, 0, and missing, indicate that the person did not have Part D that month. N is would signify somebody who has Medicare coverage that month, but not Part D. 0 means they weren't enrolled in Medicare at all that month, but they would have been enrolled in at least 1 month that year to be in the MBSF for that year, but not in that particular month. And then missing also indicates that they had Medicare A and B, but no Part D. So kind of the same as the N's. I think that it's kind of a different value because it comes from a different source, something to do with upstream flow of data, that why there's kind of two different values for not enrolled Part D, the N's and the missings. They mean the same thing. Okay, anyway, so here is a distribution of the Part D contract ID from June of 2021. So 27%, you can see if you added up those values on the bottom here, 27% did not have Part D coverage at all in June of 2021. And the vast majority of those who did have Part D were in local MAPD or PEP plans. There are some other important Part D related enrollment variables that you may find useful to know about that I'm going to talk about now. So Part D researchers are often interested in low-income enrollees, and they want to know the level of support that they receive, for Part D premiums and cost share. So there are both federal and state programs that help people pay for their Part D premiums and cost share. So the low income subsidy and dual status enrollment are kind of two things that you can determine using the MBSF. Using a variable for the low income subsidy, you would use the cost share group code. There's one for every month. And for dual status, you would use the dual status code. And there are 12 of those as well, one for every month. There's also a summary variable for dual status, which is the total number of months that year that they were enrolled in both Medicare and Medicaid. And if I didn't already say that, dual status means someone is enrolled in both Medicare and Medicaid simultaneously. And there are also an array of variables on the retiree drug subsidy, indicating that a Medicare eligible person has drug coverage not through Part D, but actually through an employer-sponsored plan. So I'll talk a little bit about each of these variable groups one by one. So starting with the low income subsidy, this is just kind of shows you that there is quite a large proportion of members who receive the LIS. Almost 27% of Part D enrollees receive extra help through the LIS, and that was in June of 2021. The LIS is a federal benefit provided by CMS to those with low income, and it's sometimes called extra help. You hear the term extra help, that's referring to the LIS. There are different levels of benefits for premium, deductible, and copay assistance, and that is determined depending on individuals' income and assets. If we kind of break down, look at PDP and MAPD members separately, we see that MAPD members had a slightly higher proportion of LIS than PDP, about 29% versus 25%. We provide a link in the second bullet that will take you to a very useful table that I'll show you here that kind of breaks down the eligibility requirements and premium and copay benefits associated with the different levels of extra help. So this is the first 4 rows, and then this next slide contains the next 2 categories for the low income subsidy. But so this is just if you are working with this with members who have an LIS, this just can be a really helpful resource to you to remember the different characteristics of each level of the subsidy. So here is a frequency distribution of the cost share group variable from June of 2021. So these are the monthly variables that you would use to determine LIS coverage. The values in the blue rows are the ones that indicate LIS coverage. When you see the word deemed in the first 3 values there, you see the word deemed. That means that the member was automatically deemed eligible for the subsidy by CMS. For example, you are deemed eligible if you have both Medicare and Medicaid. Conversely, the word enrolled in those bottom values indicates that the member had to apply for the low income subsidy. It was not automatic. But yes, you can see that out of those who had the low income subsidy, most had that value of 2, which is pretty generous, one of the more generous levels of extra help, where the member their premium was completely paid for and they had a low copay. This is just a pie chart that will show you that the vast majority of those with the low income subsidy, their coverage was deemed, so they were automatically kind of put into the program, almost 90%. Okay, so moving on, another set of variables that point to those with low income are the dual status variables. So yes, so the dual status codes, they also occur 12 times, one for every month. And it will tell you who has traditional Medicaid versus one of the Medicare savings programs, QMB, SLMB, QI, QD, WI. Sometimes I think they're sort of called QIMB, SlimB. And so just if you're not aware, Medicaid is administered by the states. So yeah, that's kind of how it differs from the low income subsidy. Medicaid is more of a state program. Here's a frequency distribution of the dual status code variable from June of 2021. You can see that most members do not have Medicaid. And that's the value at the bottom there, non-Medicaid. But for those with Medicaid, most are enrolled in a QMB plus Medicaid coverage, including RX. And that is about 9% there with a value of 2. There is a note provided in the MBSF codebook that describes how to collapse the categories in the dual status indicator into full and partial duals. So just following that recommendation in the codebook, results in this table here. So, the majority, almost 72% in 2021, were full duals. Okay, so moving on to the retiree drug subsidy indicators. Again, these variables indicate if a Medicare eligible person has drug coverage, not through Part D, but through an employer-sponsored plan. There are, again, 12 of them, one for every month, and there's also a summary variable that tells you the total number of months in the year that the member had coverage through an employer-sponsored plan. But the subsidy part of the name of this variable is that Medicare Part D will pay a subsidy to those plan sponsors covering these members as long as what they offer is equivalent to or better than conventional Part D benefits. But since these members aren't really getting coverage through Part D, CMS does not collect Part D drug events for these beneficiaries, right? You really can't study them using CCW RIF data because their drug event data is not there. So when linking to other files, I just want to point out or mention that there are, if you look in the MBSF, there are 12 segment identifiers. And so they're not used very often. The only real use that I know they're necessary for are for premiums. And so anyway, what they are is that sometimes a given plan can have multiple segments. And the segments, the only thing that differs between the segments are their premiums. So their premiums may vary by like geographically, even within the same plan and contract. So you need the segment, you need to combine the segment identifier with the contract and PBP IDs to uniquely identify the premium. And you would get the premium from the premium file, which we will talk about later on. I just wanted to mention this so you're aware, because when you're looking through the MBSF and you see the segment identifiers, there are 12 of them and they stick out and you're like, well, what are these for? But for most linking, you will, it's really sufficient just to use the contract ID and PBP combination. And so this slide kind of shows you that all of these sort of Part D files that we talk about today will have variables that are common among the files and use them to do your joins, but they sometimes have different names, which is just kind of ideally they would all have the same names, but they don't. So this is kind of helpful. So it shows you that in the MBSF, the contract ID has that name, whereas in the drug events it's slightly different. It's called the plan contract rec ID, and in the plan characteristics files, it's called just plain contract ID. And in the bottom table there, you also can see the PBP variable